And good afternoon. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. Our patient travels here from far away, Costa Rica. Beautiful island paradise where she works and enjoys life. But she's had pain in her neck and numbness in her hands going on now for, well, building up over 7 years. She found Deuk Spine Institute on the internet. She did our MRI review. Turns out she has 2 herniated discs causing the hand symptoms, neck pain, headaches. And she decided, you know what, I don't want invasive surgery. I want the most advanced spine surgery in the world, the Deuk laser disc repair. So here she is, straight out of Costa Rica, having a vacation in Florida to have her spine surgery done at Deuk Spine Institute. Now she has 2 herniated discs, and I'm just admiring her x-ray. You see this, Henry?
Yes, we do.
That is the most beautiful neck I've seen in a long time. I could literally go down to T1, T2, maybe even T2, T3. So let's count those bones. 2, 3, 4, 5, 6, 7, T1, T2. We could actually go down to T1 and T2 if we had to, but we don't have to, thank God. So I love necks like this where you can see all the discs so easily. Our last patient was the same way. He's doing great, by the way. He has no pain. He's heading home. That was the cervical Deuk laser disc repair. We also did a knee DPR for a patient with arthritis in his right knee, and he says he has no more knee pain. I'm hoping that that lasts. With our cervical Deuk laser disc repair, our cure rate is 99%. With our knee DPR cure rate, it's 80%. It's not as good. All right, 2, 3, 4, 5, 6, 7. So I'm going to move up just a smidge. We'll start at 6, 7. Everyone agree? 5, 6, 6, 7. Sean? I'm going to move up just a smidge more. Sean? Now, the thing about it when you're doing 2 discs, and I'm the first in the world to do, 2 discs in the neck with the endoscope, Sean, you really want to sort of center your needle on the top, in the vertebral body between, and then you want to pull down to the bottom disc and pull up to the top. So 2, 3, 4, 5, 6, 7. I'm going to pull down. Shot. Now we're at 6, 7. I'm going to go in. Shot. And let's get an AP. Quick AP. AP is an anterior-posterior x-ray view. It allows me to look from the front to the back and make sure I'm in the middle of the spine. Perfect. Let's go back to a lateral. So before I place my needle in that disc at C6-7, I want to know I'm in the middle of the spine. Shot. All right, I'm going to go in. Shot. Now I'm going to place this thing inside the disc. Shot. I just went through the anterior annulus. I'm going to get an AP one more time just to make sure I like where my needle is on the front back view, because I like it on the side view. You got to use both views. 2, 3, 4, 5, 6, 7. It's perfect. Look at that, dead center. All right. We are at C6-7, the bottom of the 2 discs, and I'm going to perform a discogram where we're going to inject a little bit of dye into the disc so we can see where the tear is and make sure that we get the tear treated. Shot. Shot. There's the tear. Look at that. It's a gusher. So just so you understand, this dye should stay in the middle of the disc, right where the arrow is. It should not leak out the back of the disc. But look at that. It's coming out the back because it's going through a tear in the back of the disc. That tear is called a posterior because posterior means the back, annular tear. And that is where her neck pain and headaches are all coming from, and her arm symptoms. It's coming from a herniation stuck inside that tear. We're not doing a discectomy, folks. Other surgeons would tell you need a discectomy with or without a fusion or an artificial disc. We're actually doing an annular debridement, a very different kind of surgery that I pioneered for the first in the world to do. We're doing an annular debridement where I go in and I clean that tear within the posterior annulus and get the herniation out of there, get the inflammatory tissue out of there. All right. Heading down, shot. We're going to use the guide wire. Look at that. The disc has literally pushed the guide wire backwards because there's so much inflammation happening inside that disc. Any questions?
At this moment, no current questions.
Then while I'm getting inside this first disc, we lost our first drop of blood. I'm going to ask you, Henry, to show the audience how does a disc herniation cause so much neck pain? AP.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our animation that the way a disc injury called a herniated disc or bulging disc or ruptured disc, protruded disc, extruded disc, lip disc, degenerated disc, spondylitic disc. There are literally 10 names for the same thing. The way a disc injury causes symptoms is through inflammation. That inflammation happens right at the back of the disc. Jordan, show them where that inflammation happens. It's literally the size of a pea, right where the arrow tip is. That small, tiny little area is responsible for all the pain and suffering that associates with a herniated disc. And I use the word herniated disc because it's truly the most appropriate name for what we're dealing with. Even if you have a bulging disc, it's still a herniated disc. Protruded disc is a herniated disc. Slip disc is a herniated disc. Extruded disc is a herniated disc. Ruptured disc is a herniated disc. All of them, even degenerated discs, are herniated discs. We are now at the back of the disc. You can see we're going to take the dilator out. You're going to see the tube, the tip of that tube, and I'm going to be working through the tube to the back, right where the tip is. That's where the herniation is, at C6-7. Any questions, Henry, from the audience?
At this moment, no current questions.
Let's show the audience what we're about to do with the laser and how we do our Deuk laser disc repair. We use the laser to accurately, precisely debride the annular tear and fix this painful disc. A little pressure.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We're inside the herniation at C6-7, which is located at the back of the disc in the annular tear. You can see a piece of herniation right there, which I'm going to reach in and grab and try to pull out. It's not coming out of the tube so easily. Remember, the internal diameter of this tube is about 2.8 millimeters. So there is, some of these herniations that are around 3 millimeters are too big to fit out on their own. You need to put a little bit of grabbing to get them out. The grabber is a pituitary rongeur. It's a standard surgical tool in neurosurgery first used and developed by a neurosurgeon by the name of Harvey Cushing. Dr. Cushing practiced neurosurgery many years ago, about almost 100 years ago now. And he was one of the first neurosurgeons. Neurosurgery is a relatively young field. It's been around for just over 100 years or so, depending on what you consider to be the first neurosurgical procedure. Now, some consider Dr. Victor Horsley to be the first neurosurgeon. He actually did spine surgery. He did a tumor in the spine, took it out with a laminectomy, and many call him the first neurosurgeon. Just a matter of opinion. I don't really have an opinion about who was the first. I'm certainly not a history buff, but there are people who spend their entire career studying the history of neurosurgery. I am not one of them. I'm more focused on changing medicine to make it better for patients so they get better medical care. I guess you can call it improving access to better care. Not medical care, but better care. That's my goal in life. All right, any questions from our audience?
At this moment, no current questions.
Once again, we're looking at the tear in the back of the disc. Each one of these fluffy little things that I'm floating out, they're kind of bluish white, is a herniation. And this patient has lots of herniations in the back of her disc. We are literally looking at the back of the disc right now. There's a little bone spur right there that I'm blasting with a laser. You can see the posterior longitudinal ligament. Its fibers oriented left to right, sort of from 2 or 3 o'clock over to 9 o'clock on your camera right there. And the herniation is right here sitting on top of that posterior longitudinal ligament. Now, some herniations actually penetrate the PLL or posterior longitudinal ligament and go behind it. And if that's the case, you have to get back there and remove those fragments as much as you can safely for the patient to reduce their symptoms entirely. But what I found is that 95% of herniations do not go past the posterior ligament. The posterior ligament is wonderful in that it blocks herniations from going too far back towards the spinal cord, because just behind the posterior longitudinal ligament is the dura, and behind the dura is the spinal cord. So you want to try to avoid that area if you can and just stay superficial on the disc side of the PLL. That's the foramen right there. You're starting to see, look at all this calcification here, indicating that this problem has been going on for many years for this patient. She's not an older lady, she's a young lady. But a lot of people get into car accidents when they're younger, where they end up damaging the discs in their neck or back. And, you know, maybe they don't have a lot of symptoms right away, but there's a couple of pieces of herniation there. But what happens, folks, is over time, the tear, which occurs during the car accident, there's two things that happen during the accident. Number one, annular tear. Number two, fragmentation of the adjacent nucleus pulposus. The nucleus is normally not in fragments. It's normally a cohesive big piece of goo. And when you get into a car accident, not only do you tear the annulus, but you also crush and fragment the nucleus next to the tear. What happens then over years of activities, normal activities like canoeing or aerobics or whatever it is, basketball, soccer, you're pushing fragments of the nucleus, fragmented nucleus out past the tear, into the tear and beyond the tear, into this area here, behind the disc. What that does is it creates inflammation. The inflammation is what causes all the patient's symptoms, because a herniation without inflammation is painless. That was a discovery that I made about 25 years ago. Herniation without inflammation is painless. What makes herniations painful is the inflammatory component. Now, a lot of doctors don't understand why a herniated disc would cause inflammation, but the answer is quite simple. A lot of doctors don't understand the anatomy of a disc properly. They make assumptions, and based on those incorrect assumptions, they miss the diagnosis and, of course, fail to treat the patient properly. The reason a disc can become painful is quite simple. Yes, it's true that the outer annulus, the outer half of the annulus fibrosus has blood supply and the inner half does not. You see, it's not the inner half that's the problem, it's the outer half that's the problem. And when you get a herniation, the piece of nucleus has left the inner half of the annulus and migrated itself through the tear into the outer half. Look at that piece of herniation in the foramen on the left side, sitting on her nerve root right there. That's that blue thing. I'm zapping it with a laser. This laser can remove herniation at 1/20th of a millimeter. That precise. That's what I'm doing right now. Since I'm working on top of her nerve, I'm removing that herniation right off the nerve. You guys see how I peeled it off there? I'm going to peel it off here too. Okay? We are in the foramen, her left foramen at C6-C7. That's exactly what we're looking at there. And that's a piece of herniation, the blue stuff. Okay? Almost done. She has got a nice mobile segment. You can see the movement of the vertebral body. This is the uncinate process down there at 2 o'clock, 3 o'clock. And there's the wide open foramen, maybe a little piece right there. We're just about done at 6-7 on the left. Any questions from our audience?
We have 2 questions. This first one is from Jacob on YouTube,
Jacob.
asking, what is the benefit over an open approach?
Well, a lot of things. Open spine surgery means the surgeon is cutting your soft tissues, right? Cutting your esophagus, your platysma, your strap muscles, your connective tissues, your nerves, your arteries, your veins. All of those important structures inside your body, underneath your skin, are being destroyed by the surgeon during spine surgery. Did you know that? They don't talk about it. You won't find that on the internet because they don't want you to know the truth. They want you to believe that their surgery is the only way, and you just have to accept that collateral damage to your body as a part of their surgery. And you know what? For the last 50 years, it's been true. You just have to accept that collateral damage. But then along came the South Koreans, Dr. Seng-ho Lee and Dr. Gun Choi, okay, at Woodidal Hospital in South Korea. They discovered, hey, why are we opening people's necks up when we can go through endoscopically and remove the herniation with some grabbers and get the pressure off the nerve root? Then we don't have to open them up. They don't have to have swallowing problems and hoarseness and take narcotic painkillers, right? So those guys taught me how to do this surgery endoscopically. I had to travel overseas to learn because it wasn't being taught in America. It was pioneered by Dr. Seng-ho Lee. Long story short, once I started doing these 4mm incision with no damage to any of the soft tissues, I realized the advantages for the patient. This is not an easier surgery for the surgeon, and it certainly doesn't pay us more money. It pays us less money than the invasive surgery. We as surgeons benefit more from invasive surgery. Patients benefit more from this type of surgery. So it's a patient benefit, really, is what it comes down to. And patients want safer, better surgery. That's why we offer it. Hope that explains it. But Henry, I think the best way to answer that question is to show our video. The Deuk laser disc repair versus invasive spine surgery. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatment such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial disc, lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial disc, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deukmedjian. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. You can see from our video there that the alternative treatments such as discectomy and fusion are far more invasive and completely unnecessary now that we have endoscopic, transdiscal laser technology like the Deuk laser disc repair. The first of its kind surgery and the best. In 20 years, I honestly haven't changed the technique at all. Got a stripper? So some of you may be wondering, am I really hearing this correctly? Is Dr. Deuk asking for a stripper? And the answer is yes. Here's why. This tip of this fiber here is coated in blue plastic. And underneath that blue plastic is a glass fiber optic cable that transmits the laser energy along the cable, bouncing internally until it comes out the end. Well, sometimes the glass tip will break and we have to strip the plastic off, and that's what Luis just did. So take a look at it now. You guys see the glass fiber inside the blue plastic?
Yes, we do.
And that's what I'm looking for. That's what I'm going to slide down the endoscopic working channel so that I can use that laser to debride the tear. Any questions? I think we had a question before we left.
Yes, we have 2 questions, both from Pawn Lust on YouTube.
Pawn Lust.
First question asking is, are thoracic facets well visualized in the MRI, and can capsule tears be identified?
Yeah, great question. So are thoracic facets well visualized on the MRI? The answer is yes, they are, if you know what to look for, which I do. Why is my laser not on? Nikki? You trying to get my blood pressure up? Yeah. All right, and then the second question was...
Well, it's part of a first question. They have another question, but they ask, can capsule tears be identified?
Can capsule tears be identified? Yes. Capsule tears can be identified post-mortem.
And then asking, I've heard that microdiscectomies remove 20 to 30% of the nucleus and sometimes more because they want to reduce reherniation. However, this seems to promote degeneration.
Yes.
Do you remove a similar amount?
I remove 0 nucleus from the disc. We don't take any. We're not performing a discectomy here. There's no reason to take nucleus out of the disc. The reason why they reherniate is because the surgeon that does a discectomy is not doing an annular debridement. If they do an annular debridement during the surgery, they won't need to do a discectomy. You see, they're taking disc out because they don't want a reherniation, but the real reason people get reherniation is not because of disc. The real reason people get reherniation is because the annular tear is still there. You guys see this right here? Where the laser fiber is, all that yellow stuff and stuff. This is totally abnormal. That is the tear. So because I'm cleaning the tear, look at that herniation come out of there. Because I'm cleaning the tear with the laser, getting rid of all the junk there, this tear will now heal. So the Deuk laser disc repair prevents reherniation because we do the right surgery, which is we clean out the tear. We don't take away disc material to reduce the likelihood of reherniation. That's what other doctors do, and it's the wrong thing to do. That's like saying, I don't want my house to burn down, therefore I'm going to demolish my house with a bulldozer. Well, okay, bulldozing your house will prevent it from burning down, you're right, but it's the wrong treatment. It's destructive and dangerous, and it leaves you with a future problem, no house. And when you start removing disc material from the center of the disc, you're doing the same thing. 8 minutes and counting. Berndes? Yes. Any other questions? Those are all very good questions, Pondlust.
Yes, we have a question coming from Atomic on YouTube.
Atomic.
Asking, once fusion has occurred, is it as expected to remain permanent?
Yes. Spinal fusion is a permanent treatment. There is no way to reverse spinal fusion. It's impossible. And it's completely unnecessary. Spinal fusion, if it truly occurs, there is no symptoms that come from the fused segment. Your symptoms will come from above or below the fused segment. So there's no reason to treat a fused segment. I have never had to treat a fused segment. There's been one exception, and that was where the surgeon actually fused but left a giant herniation in the foramen. I went in with the laser, cleaned out the herniation, unpinched the nerve root. But there was no movement at the segment, so there was definitely no back pain there, but there definitely was a pinched nerve there. That is the tear there. You guys see the tear? And I'm cleaning all the scar tissue from the side here. This is not ever going to heal on its own, and this is why you get reherniations with microdiscectomy, because the surgeon cannot do this during microdiscectomy. They cannot do a debridement. Only I can. It has to be done endoscopically, arthroscopically, and even though they'll tell you they're doing endoscopic surgery, they're not really doing endoscopic surgery. Unfortunately, they're calling what they're doing endoscopic when it's not really endoscopic. True endoscopic is what you're seeing right here. And there's only one surgeon in the United States that does this surgery. That's me, Deuk Spine Institute. Okay? Everyone else calls their surgeries endoscopic, but they're not really endoscopic. They do it for marketing purposes rather than to be truthful. And that's true for most of the world. Now, I will tell you this. Endoscopic surgery is certainly happening more frequently in countries like Korea, China, India, than in the United States. And the reason is quite simple. Those countries are being smart about spine surgery. They realize that expensive surgery like fusions, discectomy, laminectomy is unnecessary when you have endoscopic techniques. So they're promoting the use of safe and less invasive endoscopic surgeries over invasive surgeries like we're doing in the United States. The reason is because in the United States we have these companies like Medtronic and Deuk and Johnson & Johnson. They manufacture the metal and the plastic implants that go into artificial discs and ACDF fusions, and all those biologics and implants that are put into the body during surgery make huge profits. So what these companies have done is they've infiltrated our educational system. They are paying off the heads of the spine surgery at the university to teach the new doctors to do invasive surgeries that make these companies billions of dollars in profit every year. That's why the United States is getting behind in spine surgery, especially endoscopic, because our doctors are corrupt. Our system is corrupt. If you want to know more about it, watch the movie Spine Scam. Henry will put a link to the movie in the window here so you guys can watch it. But Spine Scam is a docudrama that is the first of a series of movies that we hope to produce, where they expose the truth about the spine industry, orthopedic industry in America, which is that the surgeons and the whole system is corrupt, and it's basically promoting invasive, unnecessary surgeries like fusions and artificial discs and spinal cord stimulators to profit the surgeon, the hospital, and the companies that manufacture those devices. And it's not benefiting the patient. So in places like India, where they don't have a lot of money, or China, where they're smart about it, or Korea, where they're smart about it, they realize, hey, we're not going to spend $30,000, $40,000 on a spine surgery for implants when we can do endoscopic. It's a lot cheaper for the patient. The healthcare system saves money, and the patients love it because it's less invasive. Can we turn the light down just a little bit? I think we're overexposed. Just a smidgen.
Yes, yes.
One more. That's good. Thanks. All right, we're just about done here. I've got about 2 minutes left. You can see the foramen is totally decompressed, and it looks really good. I'm going to try to remove a little more herniation on the opposite side. This is that herniation here with scar tissue. Any last questions before we end the stream, because we're just about done?
No current questions, but we do have a comment, and this comment was meant was typed before you mentioned Spine Scams, the movie, coming from Adamic, once more on YouTube, saying, by the way, I finished watching the movie last night. It really opened my eyes to the, quote, business of spinal fusion.
Yeah, good. That's the whole point. The movie has one purpose, to raise awareness about the truth. And here's why. You're not going to hear the truth from the surgeons that are recommending fusions to you and your loved ones. You're not going to hear the truth from the hospital executives because the hospitals make a lot of profits from these invasive spine surgeries. You're not going to hear the truth from the industry because the industry, these implant companies, are multi-billion-dollar international companies, and they basically have so much power and control. So the only way you're going to get the truth is from people like me who want you to know the truth, because I don't want to see people hurt. I don't want to see people getting surgeries that they don't need that are going to end up making them worse. That's the God's honest truth. All right, I'm just about finished here. All these little pieces of herniation I'm floating out, and things are looking good. You guys see all that little bit of herniation? I have to keep floating them out through the top of the tube. Just about done here. This is the last part of that herniation I got to work on, and then I'll be done. So get your questions typed up quickly so we can answer them for you.
We just got one question from Dira on YouTube.
Hi, Dira.
Asking, how you fix about the regeneration of the other disc? Major herniation can be fixed by endoscopic?
I'm not sure I understood the question entirely, but I'll take a stab at the answer. What we're doing, Dira, is we're not touching the disc. We're actually touching the back of the disc where the tear is and the herniations are. You see that piece right there? That's literally a herniation of nucleus that left the disc, went out the back, and is sitting on the nerve. The nerve root going down the arm. That's why the patients get numbness in their hands. So that is where the nerve lives, right there in that little space between the vertebrae. Okay, it's called the neural foramen. And she was getting numbness in both hands, and I just unpinched the nerves in the neural foramen. So she's going to have no more arm symptoms, no more hand symptoms, because the nerve, there's another piece right there. So that was literally a piece of herniation, that blue thing, that was sitting on the nerve, crushing it and irritating it. Now it's gone. I already did the other side. I'm going to go peek on the other side one more time. It looks like we got a little bit of herniation that popped out there. But the idea here is we're not restoring the disc back to it how it was when you were born. We are basically getting rid of the parts of the disc that are damaged, that are causing symptoms, specifically the annular tear and the interpost herniation and the extruded fragments. Look at that. There's a piece of herniation right there. You guys see that? I just pulled it out. Okay. That is a big one. It's about, what, 5 millimeters, 6 millimeters? Now, you may be thinking, that's not big. 6 millimeters is tiny. And you're right. But in the right place, it has a huge effect on the patient. And that's why I'm using a laser, because it's so precise that I can go in and remove those little pieces that are in just the right spot to cause symptoms, okay? And that's what this surgery is all about. You're not going to see the MRI looking normal when I'm done, but the patient's going to feel normal. And that's why we're here. Thanks for joining us. Any other questions?
Last question from Dira once more on YouTube, asking, can calcified discs can be fixed by this technique? Other doctors say that they cannot be fixed without spinal fusion.
All right, take a look here before I answer the question. Look at all these pieces of herniation. You guys see this? I'm picking them up with my fingertip. All right? Look at them right here. Can you guys see this, Henry? All these little fragments. By themselves, they don't do much, but when you add them all up together, they press on nerves and cause arm weakness, numbness, tingling, and then they also cause your body's inflammatory system to attack nonstop, and that's why people have headaches. That's why people have neck pain. Why is my suction not working? And that's why people have arm pain. kidding me. There we go. What was the problem? Can we avoid that in the future, please? So, to answer the question, this surgery does work for calcified disc herniations, okay? But only when they're about 80% calcified or less. So up to 80% calcified, the Deuk laser disc repair works perfect. When you get to about 100% calcified, where it's just a giant rock, it won't work. That said, I've never seen 100% calcified disc herniation. So chances are this is going to work. If you want to know, get an MRI done and just do your Zoom call with me. Guys, there it is, 4mm incision. It looks like she was bitten by a vampire with one tooth. Probably lost the other tooth biting Nikki in the ass. Thanks for joining us. I'm Dr. Deukmedjian. Have a wonderful day, and we'll leave you with one of our patients that we recently did surgery on. Great job, everybody. And good morning, I'm Dr. Deukmedjian at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4mm. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.